This is a really big chapter in culture and spirituality. Your chapter does a phenomenal job really providing you with information from the various diverse groups that are seen in the United States. As we've spoken about in chapters as we've gone along, it is that health literacy, appropriate use of translators, doing a cultural questionnaire, being aware how we care for those elders from the other groups, and really to differentiate between religiosity and spirituality. They have very different terms. The religiosity is your building, your spirituality is your way of being. We have to look at your own attitude and beliefs in spirituality and look at that from a holistic caring of your client. We want to give you strategies that could assist you to improve in that spiritual assessment of your older client. You will find that a lot of our clients have an actual diagnosis of loss of spiritual integrity. Things just change as they get older. Numerous terms that you'll see throughout this chapter to read about. So as we look at cultural awareness, we've got to, again, look at that patients have better outcome when their culture is considered. If you're going to respect my food choices, my prayer time, my need to worship, that's that mind, spirit, body connection that will improve how I'm feeling as a human being. We should, to be culturally competent is just to be able to ask. Doesn't mean I have to agree, and if it really isn't going to involve your plan of care, why wouldn't I do it? And I think that is what we really need to be aware of. They're giving you the 5 major ethnic groups across the United States in this book, and more in our location. Really, we see 3 strongly here. The Hispanic population is growing. We have our Asian immigrants and Native Americans. And one thing we need to be very careful of, though, is becoming stereotypical, saying that all Hispanics act this way or have these beliefs, or that all Asian Americans follow hot and cold principle of healing. So it again is to be culturally competent is to ask. But your book does a wonderful review for you to become more familiar with each of these. As we talked about before with health literacy, we have to look at what is called limited English proficiency, meaning that about 79% of the population speak only English. Speak a second language, 20% of the population, and that's pretty cool, okay? But what's real scary is almost 20% of the population are very well to less than very well. We need to be aware of our translation services for these people with limited English proficiency, because as you learned in nursing school, we really don't want to use the family if possible. And one of the things that you'll see in one of those video clips I have you watching is that in certain cultures, that family member may withhold information or discriminate because of the way their culture views their elders or who makes decisions within that group. So you can't always guarantee without a true translator that we're there. If you really want to get into culture in the interest of it, there is a Transcultural Nursing Society that is fascinating, has been around, wonderful resources available, very much into just a very holistic way of being a nurse. It's quite cool. And what through transcultural nursing then is you'll follow cultural patterns, and that supports this evidence-based practice that is available to us when working with others from other ethnic groups. And actually we are looking at that study of ethnogeriatrics, that as that population changes and ethnography norms change, that as nurses we have those experts out there to assist us to make sure that within our environment that we're working, we are taking that all into consideration. Also, we want to do an assessment of culture. Narrative called an explanatory model of illness. We want to understand how do they view illness, how do they see them as being sick. In some religions, some cultures, they feel that the illness is caused by beliefs, by actions, and if you don't understand that, you can just not, it gets real hard, like why don't they understand that this occurred because of this, but because of their belief system, they don't. The Scan Health Plan website, Diverse, is a mnemonic for patient encounters. I encourage you to go look out at that so you can become more familiar of a way when you're working with people who will have different needs that we need to take care of. As we look at those interventions, what we talk about is this cultural congruence, that we understand and accept it, and that as we can, we will bring in their dietary needs, we will understand the economic diversity, we will respect and try to adhere to religion and faith practices as we can in that facility or where that person is at, and that healthcare, the decisions that they make will be respected based upon that culture and religious practice to the best of our ability, because if it's informed consent and we can tell them, well, it would be better if you didn't, it doesn't matter as long as they understand and they've made their choice. When we look at dimensions of spirituality, we will look at that person's core values. We will look at how that guides their behavior and their relationships with others in the world around them. And it also lets us see that relationship between that individual and their higher power. Again, religiosity is more about the God you believe in, and that spirituality is that higher power and sense of self and awareness with others. It's a way of being. It's just really cool. I find myself to be a very spiritually grounded person. I look at my interactions with others, the good in the world, my place, what I feel are my values and my norms, but that is not the building I go to worship. Again, with anything else, we look at some theories. That continuity theory, that if they were a person that when mobile and could and went to church every morning, that and were Catholic and received the host, that's something we need to try to work with them to continue. We want to provide for spiritual resources. This is free, probably one of the easiest additional resources to obtain in healthcare, I think, are from the spiritual and religious point of view. When we look on that illness health continuum, I've actually in my practice have had to physically medicate with morphine due to spiritual pain. How that mind-body-spirit connection plays out can manifest itself psychologically as well as physically. It's quite amazing. The client is the one that decides and they choose. It has nothing to do with us. It's just for us to do a spiritual assessment to make sure, again, that their needs are in place. I don't have to agree with it, but I do have a responsibility to ask if their needs are being met or can I assist in any way. Ethics, again, falls into play. If there's no evidence of harm or risk, and even with an informed consent, we need to be, working with them to make that happen. Spirituality in the nursing profession, we're finally becoming more open and understanding about seeing the mind-spirit-body connection. But first of all, you need to assess your own attitudes. If you have a one-way view and believe your way is the only way, you are going to miss out on taking care of the needs of others. The true forms of spirituality are accepting others. And I think that for some nurses is very difficult when they're very driven by their religion they're building, when they can't see others. And this can be a big deal, as we're going to come up talking about in the next chapter on sexuality. If you have a religion that sees homosexuality as being against your religion, you have to be sure that doesn't manifest itself when you're taking care of those that are homosexual. And unfortunately, that sometimes comes through loud and clear to that person who has a different belief system than you.